Why do I urinate a little when I laugh or when I sneeze? I'm really curious to know if there's an actual scientific way to make a penis bigger. Today, I'm answering questions that you are afraid of or maybe embarrassed to ask your doctor. That's right. You guys are always flooding my comments and sliding into my DMs with some really awesome questions. But sometimes these questions get a little bit, curious or strange or interesting, not gonna lie. But then I got to thinking, if one person is wanting the answer to a particular question, chances are there are multiple people wondering the exact same thing. So today I've decided to sit down and answer them with everyone. And disclaimer, no question is off limits today. If you asked it, I'm answering it. This could get a little hairy. Hey everyone, I'm Dr. Jordan Wagner. I'm an emergency room doctor who treats everything from COVID to gunshot wounds, burns, you name it. I've created this video series to help answer some of your medical questions and the questions I get from patients each and every day. If you find this video helpful, please do me a favor and subscribe. All right, question number 1. Hey doc, I'm really overweight and try everything to lose weight, but can't seem to ever lose the weight. Should I be concerned and see a doctor? So great question, and we all struggle with weight loss. First, you should have a good relationship with a primary care doctor. That way, you know that you can start an exercise plan or change your diet, and you know you're starting from a good healthy spot with blood work and that sort of stuff, and that you're monitored. But the simplest thing is calories in versus calories out. That's the way you have to look at it first. So if you have less calories coming into your body versus the amount of your expenditure during the day, you should be losing weight. And the goal is to lose about 1 pound to 1.5 pounds, almost 2 pounds per week. Okay, you want to do this slowly. No binge dieting, no specific cleanses are going to make you lose so much weight and keep it off. The issue is we do these things where we want a pill or the quick fix to lower all our weights and lose fat, but a lot of times we get rebounds. So slow and steady over a longer period of time with good nutrition, less calories than going out, but you don't want to go super low because then your body goes into a type of mode where it actually holds on to everything, and a good exercise plan. And if you've tried every single diet out there and you're still having trouble losing weight, there could be an underlying issue that definitely needs to be checked out by a physician. Curious, how long do drugs stay in someone's system? Asking for a friend. Asking for a friend. So medications that a doctor gives you, medications that over the counter, all have different half-lives. They can be processed by our body multiple different ways, and it takes different time. You have a medication's bioavailability, how much of the medicine you're taking is actually being absorbed into your system, and how long the medication takes to break down in our system, which is called the half-life. So medication can take up to 4 hours to break down versus multiple days. The other side, which maybe this person is trying to ask, is illegal substances. So marijuana, cocaine, opiates, heroin, Percocets, all these illegal sort of substances. It depends. Marijuana can stay in your hair for a very long time if you're getting tested that way, versus in your urine could last a couple days, a couple weeks. All different metabolisms of different types of illegal substances as well, just like regular medications. Each medication, prescribed or illegal, has its own concrete metabolism and how long it would actually stay in your system. Dr. Wagner, love your channel. I was going to speak with my doctor about this because it's actually worrying me. But is there a medical reason why women's breasts could be different sizes? Is this common? Should I be concerned? I'd be remiss to say this is actually quite common. More than 50% of all women have asymmetry between the breasts. So in a nutshell, the most common reasons to have asymmetrical breasts is puberty, hormonal changes, and trauma. So should you be concerned about the asymmetry of your breasts? So if this is something new, it needs to be checked out by your doctor. If this is something you've had your whole life, it's probably less likely to be of concern. Just pay attention to it and make sure that it's not changing. If that's the case, then I would address it with your doctor or your OBGYN. Hey man, random question for you. Not to lie, I am farting more than usual. Should I be worried? Okay, we all fart. Or in the business, we call it flatus, but nobody likes us to say that because it's just a weird word. We get gas in our bodies multiple different ways and reasons. When we're speaking, we swallow air by accident, so that goes into our stomachs and then we have to pass that out. Carbonated beverages also bring gas into our system as well. Also, the foods that we eat are broken down by bacteria that are in our gut, stomachs, intestines. They break down our food. Some of the bacteria mixed with the food that we ingest will produce gas. Should it be of concern? Typically not. I feel bad for your roommates or even your coworkers, but we need to get the gas out of our body. So it is healthy to pass gas and to not hold it into your body. I have to tell you how many people have come into the emergency department that I see that don't pass gas, come with this huge distended abdomens. We do a ton of work to make sure they're okay, CAT scans, and at the end of the day, it's poop and gas. Are energy drinks actually bad for you? Great question. I have a lot of coworkers that pound these drinks all day long. I won't mention your name, Alex. Drinking energy drinks is probably not the best for you. I'll tell you why. So energy drinks give you energy mostly because they have a lot of caffeine in them. They will also add other different amino acids to them to help accentuate the effects, but most of it is caffeine. So some have up to 300 milligrams of caffeine in one can, and people are taking this all the time, all day long. If you're not sensitive to it anymore, may not do that much, but if you're pretty caffeine naive, it will make you feel horrible. Get your blood pressure up, get your heart rate up, called tachycardia, might make you feel like you're gonna pass out. I've even had friends having to go to the hospital because they've had too much caffeine and their heart rate was 150 beats per minute, which is quite uncomfortable and scary and might make you feel like you're gonna pass out, sweat, get lightheaded, and even have nausea and vomiting. So these are things to be careful of. Typically, the effects of an energy drink hit about 20 minutes to 30 minutes later, so just be aware and be careful. And depending on the drink that you're having, could have a lot of sugar. And if they don't have sugar, they have sugar alternatives. Be careful. A lot of sugar will give you energy, but will also give you a crash, which is not good for spiking in your insulin. And you don't want that extra sugar in your body. And be careful of these substitutes as well. So if you're going to have this, try to opt for something that's closer to 100 milligrams of caffeine and doesn't have any sugar. If I swallow gum, does it actually stay inside on your stomach forever? No. Old school myth, I've heard it too. If you swallow gum, it's gonna take 7 years to get out of your body. No. Our body breaks it down just like any other food. It'll probably take just a couple days for our body to process it and get it out of our stomachs into our intestines and then excreted through our large intestine and out the other side. So if you need to swallow gum, it's fine. It's not going to cause you any long-term harm, and it's not going to sit inside your abdomen or your intestines growing a gum baby and lasting up to 7 years. It'll just get out after a couple days. Is blood really blue inside of the body and then becomes red once exposed to oxygen? No. We depict that in books, medical journals, all of this, even on TV, red and blue blood, just to have a more clear cut, know that this is oxygenated blood versus this is non-oxygenated blood, arterial blood versus venous blood. But in our bodies, the oxygen in our blood makes the blood bright red. And when it gets deoxygenated or goes into our venous system to go back to our heart and then pump to our lungs, it is more of a darker maroon kind of red. Bright red equals oxygenated blood that's in our arteries. Our venous system has deoxygenated blood, which has the maroonish color, not blue. But good question. Why do I urinate a little when I laugh or when I sneeze? Actually, this is pretty common. This is called incontinence. It's a medical word for when you accidentally have a little bit of urine come out. There are a lot of reasons for this to occur. There's something called stress incontinence, urge incontinence, overflow incontinence. There's a lot of different terms, but the most common reason, weak pelvic floor muscles. So the muscles around the area where we are able to hold in our urine, especially women who've given birth naturally, they stretch out all these muscles and can have the effects later on where they have incontinence, where they either cough or sneeze or laugh and it comes out a little bit. A way to combat that is actually something called Kegels, which is a type of strengthening exercises of the muscles of the pelvic floor in the body. Other things that can cause this are something called a neurogenic bladder, where the nerves of the body are not functioning properly to the bladder, so you can lose urine that way. Sometimes when a male has his prostate removed for whatever reason, or a woman has her uterus removed for whatever reason, those procedures can also lead to somebody having incontinence, to where they have to be careful when they cough, sneeze, or laugh, that sort of thing, and they can lose urine. If somebody has this where they have it happen all the time, the other thing you can do, unfortunately, is wear a liner or make sure that you're going to the bathroom more frequently so your bladder's not so full and that you would have a little bit of urine come out. Where's the best place to get shot and still live? Where's the worst place? So please don't get shot at all. And I would say that the worst place to get shot and die would be your heart. And then maybe your head would be next, depending on how bad of a bullet, how close of a gun, different types of gun. There's multiple factors. So where would be the best place to get shot and still live is probably an extremity or your butt. So you want to miss major vessels, you want to miss bone, and you just want it to go into the soft tissue, so fat or muscle, and you want to probably go through and through so the bullet gets out of your body. Because I've said this before on many different platforms that in the medical world, we do not remove bullets if they're stuck in your body. Unless it's sitting right there where you can easily pop it out, we typically do not go fishing for bullets to get them out if they haven't made themselves out of your body just by the initial force, because it causes more damage and we can injure more structures if we try to get it out. And these are typically benign. Please don't get shot. Be safe with guns. Hi, Dr. Wagner. Love you from Gameology. I'm really curious to know if there's an actual scientific way to make a penis bigger. No joke, that's the question. So there are there's two ways to surgically try to make a penis bigger. There's a ligament that you can cut to maybe give you about a ½ an inch, as well as you can move your scrotum down the shaft of the penis to again make it appear bigger. But typically what you got is what you got. Now, creams, pills, lotions, these things do not enhance or lengthen your penis. Then other people have tried weights. So a urologist I know once said that if you actually try to use weights, you need to do it for about 6 to 10 hours a day for 6 months, and maybe you would get a ½ an inch of extended length, but that's absurd. Also, a very simple way to give the appearance that your penis is larger is to lose weight. There's something called the mons pubis, which is the pubic area above the penis or your genitals, that if you lose weight will shrink down. If you gain weight, it'll get bigger. So it doesn't necessarily make your penis bigger, but it gives the perception that it's maybe larger than it actually is. So that is a quick, easy way and safe way to make your penis appear larger. All right, that's been some thought-provoking questions, or maybe questions you didn't want to ask with me, Dr. Wagner. Let me know in the comments if you have any other medical questions or topics that you'd like me to answer. Maybe I'll include that in my next video. And please make sure you subscribe and turn your bell notifications on. When you do that and you hit that like button, you let YouTube know that you'd like to see more videos like this one. Thank you so much for watching, and stay healthy, my friends.